So I'm taking the standard precautions, wearing the right PPE. The scene appears to be safe. Is it safe?
Scene safe.
All right. And today I'm called to the scene of a man who's claiming to have severe chest pain. There only appears to be one patient. Is there any more?
No.
Okay, and there are any bystanders?
No.
Okay, so based off of the nature of the man's illness, I know that I'm likely going to need ALS backup, and if his condition worsens as I am assessing him, I'm most definitely going to need to call. Based off of the way the man is sitting, it doesn't seem as though I'm going to need any spinal stabilization. So hi sir, my name is Bo. I'm an EMT. Is there anything I can help you with today?
Yes,
Okay, what seems to be the problem?
I'm having chest pains.
Okay. All right. Can you move your arms for me, sir? Breathe in. Okay. Okay. The patient's breathing is inadequate and his breathing is shallow. So what we're going to do is we're going to put him on 15 liters of oxygen via non-rebreather mask and transport him as immediately as we can. I'm going to assess now his circulation. Okay, his pulse is weak and thready, which is even more of a concern, so we're going to get him going. Okay, so we would consider this man a very high priority patient, given that his breathing is inadequate, his respirations are shallow, his skin appears to be pale, clammy, and not doing too well. So now what we're going to do is we're going to his patient history. So would you mind telling me, sir, what happened?
I was shoveling snow.
Okay. And did that start the onset of this?
Yes.
Okay, and that was what provoked it. Can you tell me about the quality of your pain?
It's getting worse. It's radiating down my arm.
Okay. It's radiating down his arm. Can you tell me about the severity of it on a scale of 1 to 10?
10.
10 out of 10? Okay, and how long has this been happening?
About 20 minutes.
20 minutes. Okay, do you have any allergies or medications that I should be made aware of?
No.
Okay, do you have any pertinent history or anything that I should be made aware of? Any family history of heart disease or anything like that?
Not that I know of, no.
Okay. Have you eaten anything or taken any medications within the past hour?
I ate some chicken wings about an hour ago.
Okay. Okay. I'm gonna have to take your blood pressure today. You see your arm here? The patient's blood pressure appears to be 135/90. You see arm again, sir? Here. pulse appears to be 120 beats per minute. And I'm going to check on the other side just to be sure. His breaths appear to be 25 breaths per minute. So, overall general field impression of the patient is very poor. What we're going to do is we're going to put him on oxygen, like I had said. We're going to administer nitroglycerin to help ease his chest pain. So now we're going to reassess him every 5 minutes because he is in critical condition until he gets to the hospital. So now that I'm at the hospital, fast forward. Today, I've arrived at the scene of a man, Chuck, who is having severe chest pain. He described it to being a 10 out of 10, radiating down his arm. His pulse is weak and thready. His blood pressure is 135/90. His heartbeats are 120 beats per minute. He has 25 breaths per minute. They said it came about when he was outside working. We administered nitroglycerin and oxygen on our way here. We reassessed him every 5 minutes, and his condition was stable upon our intervention. Is there any questions?
No questions.
Very good.